Have you ever wondered if you're missing something simple, something natural that could help bring your blood sugar down without another prescription? Maybe you've been eating right, exercising, checking your glucose levels, but still struggling to keep those numbers stable. What if I told you that adding just a few key vitamins to your daily routine could make a real difference? Most people don't realize how critical certain vitamins are for blood sugar control and how often diabetics are deficient in them. Stick around, because in this video, we are diving deep into 4 powerful vitamins that can actually help lower blood sugar, and the science and experience behind them is truly eye-opening. You don't want to miss this, especially the third one, which has been quietly recommended by some of the top endocrinologists for years. Before we get into it, take a quick second to like this video, subscribe to the channel, and leave a comment with your biggest struggle managing blood sugar. We're here to help, and your support helps this community grow stronger. Let's get right into it. Vitamin deficiencies are often overlooked in diabetes care. Most people focus on carbs, sugar, and insulin, but what about your body's basic building blocks? Vitamins are involved in hundreds of processes in your body, including how well your cells respond to insulin, how efficiently your body uses glucose, and even how well your nerves function. If you're missing just one of these nutrients, it can throw your blood sugar out of balance, and you might not even know it. The first vitamin on our list is vitamin D, and this one is huge. Vitamin D isn't just about bone health. Research has shown that low levels of vitamin D are directly linked to insulin resistance and higher blood sugar levels. A study published in the Journal of Clinical Endocrinology and Metabolism found that people with higher vitamin D levels had better insulin sensitivity, and those who were deficient were at a much greater risk of developing type 2 diabetes. Now, here's something you might not know. As we get older, especially past 45, our skin becomes less efficient at producing vitamin D from sunlight. And since many older adults spend more time indoors, this deficiency can quietly grow over time. Many doctors now recommend having your vitamin D levels checked at least once a year, especially if you're diabetic. If your levels are low, a simple supplement of 1,000 to 2,000 IU daily can be incredibly helpful. Of course, always check with your healthcare provider before starting any new supplement. But here's what's important. Vitamin D supports the beta cells in your pancreas, the ones that actually produce insulin. It also helps reduce inflammation, which plays a major role in both type 1 and type 2 diabetes. Some studies even suggest that boosting vitamin D may help reduce A1C levels over time. Now, if you have been feeling tired, weak, or struggling with blood sugar spikes even when you're doing everything right, low vitamin D might be part of the problem. Quick reminder, if this is helpful so far, give this video a thumbs up and share it with someone you care about. You never know who needs this kind of information. Now, the second vitamin we need to talk about is vitamin B12. Vitamin B12 is essential for nerve health, red blood cell production, and brain function. But here's the kicker: many people with diabetes, especially those taking metformin, are deficient in B12 and don't even know it. In fact, long-term use of metformin, one of the most common diabetes medications, has been shown to significantly reduce B12 absorption. Why does this matter? Because low B12 can lead to nerve damage, fatigue, weakness, and even memory issues. And in diabetics, nerve health is already a concern. Peripheral neuropathy, numbness, tingling or burning in the kidney. Hands and feet is one of the most common and painful complications of diabetes. If your B12 levels are low, it can make these symptoms worse or cause them to start sooner. Several clinical studies have shown that B12 supplementation can help reduce nerve pain and may even help prevent nerve damage in diabetics. In fact, many doctors now routinely recommend B12 supplements for patients on metformin, especially older adults. The good news? B12 is water-soluble, meaning your body gets rid of any excess. So it's generally very safe even in higher doses. You can get B12 naturally from foods like eggs, dairy, meat, and fish. But if you're vegetarian, vegan, or over 50, your body may have a harder time absorbing it from food. In that case, a sublingual B12 supplement, or even B12 injections for more severe cases, might be recommended. Now ask yourself, when was the last time your B12 levels were checked? Still with me? Good, because the next vitamin on our list is one of the most overlooked, but possibly the most powerful when it comes to managing blood sugar. But before we get into it, let me ask you a quick question. Have you subscribed yet? If not, hit that button now and turn on notifications. We've got more life-changing info coming up, and I promise you don't want to miss it.
Now, let's talk about the third vitamin that can make a huge difference in your blood sugar, and that's vitamin C. Most people associate vitamin C with colds and immune health, but its role in diabetes is far more important than you might think. Vitamin C is a powerful antioxidant, which means it helps reduce oxidative stress in the body. And why does that matter for diabetics? Because high blood sugar creates oxidative stress. Basically, it's like a slow burn in your bloodstream. Over time, that damage can affect your blood vessels, your eyes, your kidneys, and your nerves. That's one of the reasons diabetes is linked to so many long-term complications. Vitamin C helps to neutralize that damage. But that's not all. Studies have shown that people with diabetes tend to have significantly lower levels of vitamin C in their blood compared to those without. Diabetes. This isn't just because of poor diet. It's because high blood sugar actually prevents vitamin C from being properly absorbed into the cells. So even if you're eating oranges or taking a multivitamin, it might not be enough. Now here's where it gets interesting. A study published in Diabetes, Obesity and Metabolism found that supplementing with just 1,000 milligrams of vitamin C daily for 12 weeks significantly lowered fasting blood sugar and improved blood pressure in people with type 2 diabetes. That's powerful stuff from a simple, affordable vitamin. Vitamin C may also help improve insulin sensitivity, especially in older adults. This means your body responds better to insulin and glucose can move into your cells more effectively, keeping your blood sugar balanced. Natural sources of vitamin C include citrus fruits, strawberries, bell peppers, broccoli, and kiwi. But if you're not eating these daily, and especially if you're over 45, a supplement might help bridge the gap. Now, if you are someone who's constantly dealing with fatigue, slow wound healing, or blood sugar spikes, even with a careful diet, it may be time to consider adding vitamin C to your routine. Always start small and talk with your doctor to find the right dose for your body. If you are getting value out of this video so far, don't forget to leave a comment below and let me know which of these vitamins you are already taking or thinking about adding. I'd love to hear from you. Now let's get to the fourth and final vitamin on our list. And this one might surprise you. It's vitamin E. Vitamin E is another antioxidant, and while it doesn't get as much attention in diabetes care, it absolutely should. It plays a critical role in protecting your cells from damage, improving circulation, and supporting nerve health. But what's really fascinating is how it relates to insulin sensitivity and glucose control. A review published in the American Journal of Clinical Nutrition found that vitamin E supplementation could improve insulin action in individuals with type 2 diabetes, especially when combined with other antioxidants. In simple terms, it helps your body use insulin more efficiently. Now here's something practical. Vitamin E also supports the health of the eyes and nerves, which are two areas that diabetes tends to affect the most. Diabetic retinopathy, AE, leading cause of vision loss, has been linked to oxidative stress, and vitamin E helps counteract that. For nerve pain and tingling, especially in the feet and hands, some research shows that vitamin E may reduce inflammation in nerve tissues and improve symptoms over time. Combined with B12, it may provide even better results. You can find vitamin E in nuts, seeds, spinach, and avocados. But here's the catch. Most people, especially older adults, don't get enough from food alone. If you're eating a typical diet that's low in healthy fats or plant oils, your levels might be lower than ideal. A standard vitamin E supplement usually provides around 400 IU per day, but again, it's important to talk to your healthcare provider before starting any supplement, especially if you're taking medications like blood thinners, since vitamin E can impact clotting. Now let's recap what we've covered so far. We talked about vitamin D, which helps improve insulin sensitivity and supports your pancreas. Vitamin B12, which protects your nerves and is often depleted by diabetes medications. Vitamin C, which lowers oxidative stress and supports stable blood sugar. And just now, vitamin E, which improves insulin action and protects your nerves and eyes. 4 simple, affordable vitamins, 4 game changers for people with diabetes. And what they all have in common is this: they work with your body, not against it. If you are watching this and thinking, maybe this is what I have been missing, you're not alone. Many people have experienced better energy, reduced symptoms, and more balanced blood sugar after correcting these deficiencies. But here's the key. It's not about guessing. Ask your doctor to run a basic blood test for these vitamins. It's a small step that could change everything for your long-term health. And if you found even one helpful tip in this video, make sure to hit that like button and subscribe. Because next up, we're going to talk about real-life ways to get these vitamins into your routine, whether through food, simple supplements, or both. We are also going to cover how to avoid the most common mistakes people make when taking these vitamins, and how to pair them with lifestyle strategies that really work for adults over 45. Now that you know which 4 vitamins can actually help lower blood sugar and support your body in powerful ways, the next question is, how do you start? Let's make this simple and realistic. The goal isn't to overhaul your entire routine overnight. It's about making small, smart changes that add up, especially if you're managing diabetes after age 45. First, get tested. Ask your doctor to check your vitamin D and B12 levels. These are standard blood tests and often covered by insurance or included in annual checkups. If you're feeling fatigued, forgetful, numbness in your feet, or just not like yourself, these levels might hold the answer. For vitamins C and E, routine blood tests aren't usually needed unless there's a specific concern, but your symptoms, lifestyle, and diet can help guide whether supplementation is worth exploring. Second, look at your daily food habits. Here's a simple checklist. Do you get outside in the sun at least 15 minutes a day without sunscreen? If not, you may be low on vitamin D. Are you eating leafy greens, nuts, seeds, citrus fruits, fish, eggs, or dairy regularly? If not, vitamins C, E, and B12 may be lacking too. Are you taking metformin or any acid-blocking medications? Those often deplete B12 over time. Once you have got a general idea of where you might be low, you can choose whether to start with foods, supplements, or both. And remember, it's perfectly okay to start small. One change is better than none. For vitamin D, consider taking a supplement of 1,000–2,000 IU daily if your levels are low. If you are significantly deficient, your doctor might prescribe higher doses for a short time. Also, a little sun exposure, even through a window or while walking, can help. For B12, many people do well with 1000 mcg sublingual, under the tongue, tablets daily. This form doesn't rely on stomach acid for absorption, which is especially important for older adults or those on medications. For vitamin C, a balanced diet rich in bell peppers, oranges, broccoli, and berries is a great start. If supplementing, start with 500-1000 milligallons daily, preferably in 2 divided doses to help with absorption and minimize any stomach upset. And for vitamin E, eating almonds, sunflower seeds, and spinach regularly is excellent. But if those aren't part of your daily meals, a supplement of 200-400 IU may be helpful, again, depending on your doctor's advice. Now here's a quick but important tip. Timing matters. Take these vitamins with meals, especially those that contain some fat, since vitamins D and E are fat-soluble and absorb better that way. For B12, taking it in the morning can help with energy levels throughout the day. You might also be wondering, do these vitamins work alone, or should they be combined? The answer is both. Each vitamin offers specific benefits, but when taken together with a healthy diet, gentle movement like walking, good sleep, and blood sugar monitoring, they can amplify each other's effects. Think of them as part of your full-circle care routine, not a magic pill, but a solid support system your body can rely on. Here's a real-life example. I recently spoke with a retired teacher in her late 60s. She had been struggling with stubbornly high morning blood sugar, fatigue, and painful tingling in her feet. After talking with her doctor, she added a daily dose of vitamin D and B12 and began eating a small bowl of berries with nuts for breakfast. In just 3 months, her A1C dropped half a point and her energy improved. Her story isn't unusual. It's what happens when we support the body where it's missing key nutrients. Now, if you are listening right now and thinking, this might be exactly what I have been needing, you are probably right. Vitamins are not a replacement for medication or medical advice, but they are powerful tools that most people overlook. Don't let that be you. Check your labels, talk to your doctor, add in a few more nutrient-rich foods, and if supplements make sense for you, use them wisely and consistently. These small steps could mean better blood sugar control, fewer complications, and more energy to enjoy your life. That's what we all want, isn't it? If this video helped you in any way, hit the like button right now, subscribe to the channel, and tap the bell so you don't miss the next video. We've got more real-life, research-backed strategies coming your way. Because managing diabetes doesn't have to be overwhelming. It can be calm, clear, and even empowering when you have the right guidance. And remember, your health is worth fighting for, and you're never too old to feel better than you do today. Thanks for watching, and I'll see you in the next video.